Assalamualaikum warahmatullahi wabarakatuh. My name is Nuruna Syatubalkis binti Muhammad Fazli from class 4 Razi. In this video, me and my friends Nuri Edina Umaira binti Ramin Fazli and Isja binti Muhammad Khairul Mahsalis are going to talk about 6 health issues that has been affecting many people from across the world. First, I'm going to talk about bulimia nervosa and diabetes mellitus. Bulimia is a psychological eating disorder in which you have episodes of binge eating, which is consuming large quantity of food in one sitting. During this binge, you have no sense of control over your eating. Afterward, you try inappropriate ways to lose weight such as vomiting, fasting, enemas, excessive use of laxative and diuretics, and compulsive exercising. Bulimia tends to start in late childhood or early adulthood. Persons with bulimia usually binge and purge in secret because they feel disgusted and ashamed when they binge, and relief once they purge. Their weight is usually within the normal range for their age and height, but they may fear gaining weight, want to lose weight, and feel very dissatisfied with their body. The exact cause of bulimia is unknown because many factors could play a role in the development of eating disorders, including the genetics, biology, emotional health, societal expectation, and other issues. Bulimia signs and symptoms may include being preoccupied with your body shape and weight, living in fear of gaining weight, repeated episodes of eating abnormally large amount of food in one sitting, feeling a loss of control during binging, forcing yourself to vomit or exercising too much to keep from gaining weight after binging, using laxative, diuretics, or enemas after eating when they are not needed, fasting, restricting calories or avoiding certain foods between binges, and using dietary supplements or herbal products excessively for weight loss. The primary treatment for bulimia often combines psychotherapy, which focuses on altering habits such as binging and purging, antidepressants such as selective serotonin reuptake inhibitors, including Celexa, Lexapro, Prozac, and Zoloft, and nutritional counseling. Diabetes mellitus usually happens when your body isn't able to take up sugar or glucose into its cells and use it for energy. This results in the buildup of extra sugar in your bloodstream. Diabetes can be divided into two types, type 1 diabetes and type 2 diabetes. Diabetes happens because having too many glucose circulating in your bloodstream. However, reasons for why blood glucose levels are high depends on the type. Type 1, caused by your immune system destroying the insulin-producing cells. Meanwhile, type 2 is caused by pancreas that can produce enough insulin to overcome the resistance of body cells to insulin. Symptoms for diabetes may include increased thirst, weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, unplanned weight loss, frequent urination, frequent unexplained infection, and dry mouth. For type 1 diabetes, symptoms can develop quickly over a few weeks or months. Symptoms begin when you're young as a child, teen, or young adult. Additional symptoms include nausea, vomiting, stomach pains, and yeast infections or urinary tract infection. For type 2 diabetes, you may not have any symptoms at all or may not notice them since they develop slowly over several years. The symptoms usually begin to develop when you're an adult. For medical treatment, persons with type 1 diabetes can get a pancreas transplant if possible. However, getting an organ transplant requires taking immune-suppressing drugs for the rest of your life and dealing with the side effects of these drugs. Bariatric surgery is an option if you have type 2 diabetes, are obese, body mass index over 35, and consider a good candidate for this type of surgery. Other options beside the surgery is you can use insulin pen or insulin pump to deliver insulin inside your body. People with diabetes might have to use it for the rest of their life.
Assalamualaikum, I'm Nurin Ijana Umaira from class 4 Razi. We'll talk about gastritis and obesity. Gastritis is an inflammation, irritation, or erosion of the lining of the stomach. It can occur suddenly or gradually. Gastritis can be caused by irritation due to excessive alcohol use, chronic vomiting, stress, or the use of certain medication such as aspirin or other anti-inflammatory drugs. it may also be caused by any of the following: Helicobacter pylori, a bacteria that lives in the mucous lining of the stomach without treatment. The inflammation can lead to ulcers and in some other people stomach cancer. Next is bile reflux, a black flow of bile into the stomach from the bile tract. After that, we have infection caused by bacteria and virus. Symptoms of gastritis vary among the individuals, and in many people there are no symptoms. However, in most common symptoms include nausea or recurrent, abdominal bloating, indigestion, hiccups, loss of appetite, vomiting, blood or coffee ground-like material. Ways to overcome gastritis by treatment usually involves taking antacids and other drugs, proton pump inhibitor, or to reduce stomach acid, avoiding hot or spicy foods. For gastritis caused by H. pylori infection, your doctor will prescribe a regimen of several antibiotics plus an acid blocking drug. If the gastritis is caused by pernicious anemia, B12 vitamin shot will be given. Eliminating irritation food from your diet, such as lactose from dairy or gluten from wheat. Medical tech used for gastritis is upper endoscopy and endoscope. A thin tube containing a tiny camera is inserted through your mouth and down into your stomach to look at the stomach lining. The doctor will check for inflammatory and may perform a biopsy, a procedure in which a tiny sample of tissue is removed and then sent to a laboratory for analysis. Next, blood test. The doctor may inform various blood tests such as checking your red blood cell count to determine whether you have anemia, which means that you do not have enough red blood cells. They can also screen for H. pylori infection and pernicious anemia with blood tests. Facial occult blood test. These tests check for the presence of blood in your stool, a possible signs of gastritis. Next, we have obesity is a complexion disease involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. It's a medical problem that increases your risk of other diseases and health problems such as heart disease, diabetes, high blood pressure, and certain cancer. Obesity is generally caused by eating too much or moving too little. If you consume high amount of energy, particularly fat and sugars, but do not burn off the energy through exercise or physical activity, much of the surplus energy will be stored by the body as fat. Symptoms, the most obvious symptom is the increase of weight. Therefore, the symptom that may be present arise from the increase in weight that, among other, may be difficulty in sleeping. Obesity is associated with sleep apnea, which is cause of daytime drowsiness and insufficient restful sleep. Next, we have back and or joint pains. After that, excessive sweating, intolerance to heat, infection in skin folds, fatigue, depression, feeling of shortness of breath. And ways to prevent obesity is consume less bad fat and more good fat, consume less processed and sugary foods, eat more serving of vegetables and fruits, eat plenty of diabetes fiber, focus on eating low glycemic index foods, get the family involved in your journey, engage in regular aerobic activity. A medical technology used for obesity is wearable sensors, gamification, educational support, and online counseling is one of the ways they use to help patients with obesity.
Assalamualaikum, my name is Izdia. I am from class 4Z. Today I want to present about my topic, which is anorexia nervosa and muscle dysmorphia. First, we will talk about anorexia nervosa, which is they will intentionally restrict their food intake as a way to help them manage emotional challenges. They have a fear of gaining weight and a desire to lose weight. The symptoms are severe loss of muscle mass, low blood pressure, dizziness, dry lips, insomnia, limiting the overall food intake, assessing their body weight and size frequently, cooking for others without eating. The causes are past criticism about their body weight, low self-esteem, anxiety, a history of dieting, sexual abuse. Ways to cure this is cognitive behavioral therapy, family and individual counseling. Next, we will talk about muscle dysmorphia, which can be known as bigorexia, megorexia, or reverse anorexia. It is a delusional or exaggerated belief that one's own body is too small. The symptoms are having perfectionist tendencies, avoiding social situations, seeking cosmetic procedural satisfaction, constantly comparing your appearance with others. The causes are family history of the disorder, abnormalities in the brain. Ways to cure this is selective serotonin reuptake inhibitors, or called SSRIs, and endocrine treatment. And that's all from me.